I was just prescribed Anavar. I didn't tell my doctor about my hepatitis C. So how high or low is it in terms of liver toxicity? Mizumi is the #1 product for acne problems on TRT. Check out the products using the link in the description under this video.
I dislike the term Anavar because Anavar was a brand name drug that was discontinued in the 90s. The medication name is Oxandrolone. And if a provider or a clinic told you that they are prescribing you Anavar, I would question that clinic as to their competency to care for my well-being. We have thousands of patients in my practice, and we have, I believe, 1 or 2 gentlemen total who we prescribe Oxandrolone to. It's indicated medically as a muscle wasting preventative agent. It's an anti-catabolic specifically for use in burn victims, HIV patients, cancer patients on chemotherapy, or anyone with a significant muscle wasting disease or syndrome. So what we use it for in androgen therapy is primarily due to the fact that in the United States, we cannot access and prescribe Proviron, which is a medication widely available in Europe that helps men not only with fertility, but also binds tightly to SHBG, sex hormone binding globulin, which allows for more effective freeing of free testosterone. So the problem a lot of men have when they're on therapy is they have sufficient total testosterone levels, but they have elevated SHBG levels, which are idiopathic, which means we cannot determine why, but after trial and error of everything imaginable to normalize the SHBG level, after ruling out any liver issues, sometimes it's merely genetic, we are forced to treat with a mild DHT derivative. And in the United States, we choose Oxandrolone at very low doses because it is the least hepatotoxic DHT-derived synthetic medication. So that is the only indication that we use Oxandrolone for. That was not the gentleman's question, but I sort of answered it in that explanation. It is the least hepatotoxic DHT-derived medication of all oral C17 alpha alkylated steroids, and this is dose dependent. So if it is used at 5 to 10 milligrams per day, which is the way we prescribe it, then you really should not have any liver concerns. However, if you already have hepatitis, I would communicate this with your provider because you're already under liver duress and you should have your liver enzymes monitored and possibly scanned to make sure that you do not contribute to any further damage. If you're being prescribed Oxandrolone for the purposes of muscle building, forgive me for presuming here, but when you call it Anavar and you say that you are hiding a pre-existing condition from your provider, I'm going to go out on a limb and say that this is a manipulated prescription for the sake of bodybuilding. That is not the intended use here, and that is not something that I will condone, especially for somebody with an existing case of hepatitis.
Yeah, sure thing.